Hey everyone, this is Amanda Pierce-Kelly with NAC. I'm the National Advocacy Director. I am so excited to have you all with us today to officially kick off National Health Center Week planning season with our annual kickoff webinar. We are thrilled to be joined by a couple of pros from our health center colleagues in the field. Elizabeth Kwasnick and Dorian Wanzer are going to walk through some of the do's and don'ts to get you up to speed on how to plan and execute a wonderful event. And really, it is not an understatement to say that National Health Center Week is absolutely one of our most favorite times of the year, because it is all about dedicating the time to showcasing and celebrating the work that you all in the field do best. So with that, a couple of housekeeping items to start. For those of you that have questions during the webinar, you can use the chat box. You can see hopefully the graphic here on the right-hand side of the screen or the slide. Anytime you have a question, just go ahead and type your question into the chat box. We'll go ahead and take those hopefully live throughout the discussion, but at a bare minimum, we'll make sure we leave some time at the end to take up your questions. The other thing that I would say is that the webinar is going to be recorded today, so if you would like to refer the discussion, the slides, and the information out to folks, you can access the recording and the slides on both the Health Center Week website and the Health Center Advocacy Network website. Usually it takes about 24 to 48 hours for us to get that posted and available to folks. The other big piece to start is just a very, very big thank you to all of our National Health Center Week sponsors. Truly, what allows us to continue to grow and see greater success with National Health Center Week every year is the wonderful and generous support of our sponsors for National Health Center Week. I want to call attention especially to our gold sponsors, Athena Health, McKesson, and Pfizer RX Pathways, and really everybody on the slide that you see in front of you, our silver and our bronze sponsors as well. And the thing that I would say about our National Health Center Week sponsors is that these companies and partners of ours are really doing the most they possibly can to put resources and support back into the field. So by sponsoring National Health Center Week, they're allowing the national celebration and recognition to grow and strengthen and be visible across, every imaginable community out there across the country. But a lot of the resources and support that they're providing are actually going right back into the field at the health center level. These are not just corporate sponsors. These are true friends and partners to health centers on the ground. So just a huge shout out to our National Health Center Week sponsors, and thank you for allowing us to continue to grow and be so successful every year. So with that, we're excited to share, and hopefully this is not a surprise, hopefully you all have seen this already. This year's theme for National Health Center Week is Celebrating America's Health Centers, the Key to Healthier Communities. The dates this year are August 13th to the 19th. We'll, I think, discuss a little bit about why the timing of National Health Center Week. But on the theme, we try to come up with a theme year to year that really is going to resonate with the issues of the day and the policy priorities and, frankly, the program priorities that we're really working on diligently throughout the year. And so health centers, as we all know, are the key to healthier communities. And so we're hoping that you all will use this theme to help build your events and hinge some of your messaging and your PR and certainly the way that you craft this to support your community with this particular element in mind, that health centers are the key to healthier communities. Now, that being said, sometimes the Health Center Week theme works really well with the format and the event plans that you have, and sometimes it's not so easy to incorporate it in. So in no way is this meant to be rigid for you in the way that you craft and formulate your event, but where it can be helpful in allowing you to, again, create that hook around how you're engaging your community and telling the health center story and delivering the health center message. We just really encourage you to take advantage. There's a few other things happening this year for National Health Center Week that we're really excited about and that are brand new. The first is that we have a brand new Health Center Week website. Fortunately, it's the same web address, www.healthcenterweek.org, but it has a brand new look. We did a lot of work, and big kudos to my team, Alex Harris, Dorian Wanzer, and Elizabeth Kwasnick, for really driving our efforts on updating the website to make sure that you guys have the most up-to-date and beautiful set of resources possible to support you in your event plans this year. But if you haven't had a chance yet, please take a look at this beautiful brand new website, all of the incredible tools and resources that we've put together in order to empower you in the process of planning your events and executing your events. We have everything you can imagine up there, from resources to support the actual event planning process, sponsorships, media toolkits. We're going to go through an entire list of resources later on, so I won't go much more details than that. But point being, if you haven't had a chance, go ahead and take a look. This is also where we'll be asking you to post your events, and so that's a very important part of the Health Center Week website. We're excited about this brand new look to spruce up what is already a very exciting part of the year. We will also have several sets of media templates this year. Those are going to be becoming available on sort of a rolling basis. You'll see an overarching set of templates to support National Health Center Week activities as a whole, and then we'll have some actually that support the themed focus days within the week. The Health Center messaging is very consistent, but we always want to be thoughtful about what lens we're using to tell that story, and so the templates this year are going to reflect that. We've also done a lot of work the last year and building this year dedicated to partnerships and opportunities to work with partners around National Health Center Week, and I'm going to get into that in the next couple of slides here. But would just encourage you all on the ground, and for those of you at primary care associations, to be thinking creatively about how you can work with your partners during National Health Center Week to really strengthen and embolden the celebrations and the events that you're hosting. We know that Health Center Week gets bigger and bigger every year, and part of the reason for that is because of the partnerships that we have and the voices of those who understand and support health centers sort of echoing our message across the country. So just dedicate some time, we certainly have, to crafting those partnerships in such a way where they can support your Health Center Week celebrations and activities. And the last piece is that we've updated our 2017 focus days, which is a perfect segue to our next slide here. Last year, for the first time ever, we decided to move beyond just recognizing the work that health centers do with special populations. So for at least the last 10 years, we've always recognized the work of public housing health centers, our healthcare for the homeless health centers, and our agricultural and migrant farm worker health centers for the work that they do to serve those special populations. Well, last year we decided, you know what, we really do want to provide a little bit of emphasis and create an echo chamber around some of the other important themes and focus work that health centers do across the nation and in their communities. And it was very well received. And so we're back at it again this year, but we have a new set of focus days beyond, again, the special populations that we always recognize. So you'll see here in front of you that Sunday this year will be dedicated to elected officials. Monday, we are once again going to be recognizing Health Screenings Day. Speaking of partnerships, and we'll talk about this in a moment, we have a wonderful partnership with the American Cancer Society, as do a number of primary care associations and health centers on the ground locally in doing work on health screenings, specifically for cancer prevention, in partnership with the American Cancer Society. Well, this day, we really are working hard to showcase that partnership, and we'd encourage you guys to do the same at the local and the state level. Building off of that, Friday this year, we're going to be dedicating to Consumer Board Member Day. The role of the Consumer Board Member within the Health Center program is one of the most unique elements of health centers. The fact that we are community-owned and operated, and that the operations are being overseen by members of the community, our patients, is such an important part of what makes the health center model so successful. And so this year, we really want to take the time to recognize that role, to educate the community and all of the various stakeholders, elected officials, about the fact that that's one of the things that makes health centers so different, but also educate our community about the fact that this is a unique element of the health center model as well. I think we sometimes take for granted the fact that even though we know that our patients are sitting around our governing board on a monthly basis, the community might not know that. And so we're just really encouraging folks to celebrate this unique element of health centers and to do some education around the importance of this to the health center model. And the last day there, Saturday, is going to be dedicated to Children's Health Day. Because of the timing of National Health Center Week and one of the most frequent event formats that we see year to year, being back-to-school fairs and, lots of activities geared at children's health, we wanted to dedicate a specific day within the week to celebrating that work that health centers do to engage and make sure America's children are kept healthy. So we're going to be dedicating that Saturday to Children's Health Day. I do want to just take a minute to speak to the partnership element that I mentioned, and in particular the American Cancer Society. What you have up in front of you is actually a slide that was taken from our wonderful partners at American Cancer Society. Morgan David, who is our primary point of contact at American Cancer Society on National Health Center Week, was wonderful enough to come and present with us during the Policy and Issues Forum as part of our National Health Center Week education session. And this just tells you a little bit about how NAC and the American Cancer Society will be working together in order to showcase that partnership. And so it gives you an idea of some of the activities and what you might do on the ground locally in trying to showcase the good work that you're doing together. And whether it's the American Cancer Society or other partners in the community, this just serves as a really wonderful model of some of the things that you might want to consider this year. The other thing that you can do specifically as it relates to American Cancer Society for some of you who are working with them on the ground locally, these are the ways in which ACS is actually encouraging their own folks and health centers to be in touch about National Health Center Week. So, for example, inviting your contact at the American Cancer Society to partner with you on your event is one of the first and foremost things that we would recommend. The trick, of course, is going to be to start planning now with your American Cancer Society partner in order to tell that story of prevention and screening in the community, to identify the different resources and tools you might need to have that successful event. The other thing is that ACS, in this particular case, is going to be creating a toolkit specifically for National Health Center Week. They're going to have their own media templates that they can use in partnership with their health center contacts, and really to recognize the good work and partnership that's going on the ground every day. And the last piece is to identify where there are great examples of how this work has been successful. And so again, whether it's in the space of health screenings and cancer prevention or in other areas of work for health centers, just really encourage you guys to be thoughtful about telling the story and identifying individuals who can tell that story firsthand. So with that, I am going to turn it over now to Elizabeth Kwasnick to introduce our wonderful speakers from the health center world who are pros. And then from there, we'll go on to some more discussion about tools and resources and keep the ball rolling. Elizabeth?
Sounds good. Thanks, Amanda. And it is my distinct pleasure to introduce to you two absolute rock stars in the realm of National Health Center Week and other things advocacy. We have Molly Ferguson from Florida Community Health Centers, and Rebecca Shaw from Lorain County Health and Dentistry in Ohio. And I am going to first turn it over to Molly, and we're going to hear from both of these wonderful women about how they plan and execute National Health Center Week events in their communities.
Well, thank you very much, Elizabeth and Amanda. It's nice to talk to you all again. Dorian, it's nice to see you online. My name is Molly Ferguson, and as Elizabeth said, I'm with Florida Community Health Centers, and it is a cloudless, beautiful, sunny day here in Florida, and I hope you all are experiencing similar weather wherever you may be calling in from. Wanted to share with you some of our experiences with National Health Center Week. But first I wanted to give you a little bit of background on who we are. Like all of you, we are federally qualified health centers. We have 12 health center sites. Let me get to... Are we able to bring up my PowerPoint presentation, ladies?
Yes, if you just tab over, there should be another tab at the top of the screen for you.
Oh, there you go.
There you go.
There you go. A little slow on the uptake. Okay, as I said, we have 12 health center sites. In 2016, we were just shy of 50,000 patients, generating almost 180,000 visits. And you can see there the services that we provide within our centers. We are patient-centered medical home and Joint Commission accredited. And there you'll see a map. So you'll see geographically our services are very diverse. We have this big lake in the middle of the state of Florida called Lake Okeechobee, which really creates a geographic barrier to many services as patients live in the areas around the lake. We've had quite a bit of experience with National Health Center Week, and it's always a great week for us. Everybody from our CEO across the board, our clinicians, and our front desk people are all very involved and very excited about the events that we are privileged to participate with. Some of the events that we've had, you'll see on the screen there. I won't read them all to you, but you'll see that there's a variety of events there. One of the things that we really pride ourselves on is grassroots events. We work with the communities, many of our smaller cities and the rural communities. The counties may be having events, particularly around back to school, so we partner with them. We're fortunate enough, we've done a number of radio shows. We have faith-based representation on our board of directors, which helps us get in with the faith-based community. It's interesting, my colleague Jonessa and I just left a chamber event to be on the call, so we always try to make sure that the chamber members and the business community know what we're doing and bring them in as well. One of the newest things that we've been involved in St. Lucie County in particular, which is a large county that we serve, is a new teacher orientation. And the school districts put on an event every year with anybody who's a brand new teacher. And we are fortunate enough that we're participants in that, so we get to talk to the teachers, introduce them to the services that we provide. And what we have found is they have not only taken that information back for themselves, but then they share it with their students throughout the school year. So the teachers in our communities are wonderful advocates for us as well. This year, I don't think there'll be a lot of voters registration, but of course, no campaigning. Please keep that in mind. And we always engage our line staff. After the call, I invite you all to visit our YouTube page, which is Florida Community Health Centers. We have several videos up there which are actually quite entertaining that talk about some of the events that we've had throughout the years. And I just wanted to provide some tips for a successful event. We have been very fortunate over the years to be in partnership with several of the sponsors for National Health Center Week, Henry Schein, Athena, and NextGen, as well as Benco and Centene. If you haven't reached out to your sales reps through your purchasing departments yet, I encourage you to do so. They are great representatives, not only with their financial contributions. We've had sales reps come out and help with dunk tanks and just helping people through lines, through Navigate, give out backpacks and back-to-school supplies. So they've really been terrific partners with us. And none of this would be possible without the team from our State Primary Care Association, the Florida Association of Community Health Centers. They are with us every step of the way. They're always making sure that anything that we need, any contacts that we need to make, especially with legislators, they help us with getting in contact with the people who they may be back in their districts, so sometimes it's a little bit difficult to get them. If you have not started planning yet, I encourage you to do so by close of business on May the 10th. If nothing else, just to get your ideas down on paper, because once you have those ideas down, you can really start working with your community. You may find that the Rotary in your community or the Kiwanis in their community want to come out and they'll barbecue and they'll donate the food. So really bring in those local resources. And as I mentioned, when there's similar events, it's always terrific to partner with them. Staff for us has been instrumental in coming up with ideas. After a while, we get a little bit jaded, and we find that some of our best ideas have come from our line staff. And if you have the time, as I said, to visit our YouTube page, you'll see a number of our staff participate in our National Health Center Week. Always invite your legislators. They love coming to these events, especially when they're up for re-election. It really gets them back in with their constituents, and just a terrific event all the way around. You can't lose when you have your legislators involved. I encourage you to diversify your partners. I talked about some of our corporate partners. We also bring in barbershops, beauty salons. They give away free haircuts. We have a variety of sororities and fraternities that are in our communities, and they love to be involved in these events. So bring them in. Advocacy days are terrific, especially when you start talking about your board members in the homeless community. Always make sure that you promote your advocacy days. We're very fortunate that we have a social media guru on staff now with Jonessa Rodriguez, and she has really just taken our Facebook page to another level and continues to have great ideas to promote them. So keep your social media going. That's where everybody is looking for anything. And your local PSAs with local small radio stations. If you can get the larger stations, that's terrific, as well as your online newspapers. More and more we're finding that the paper newspaper is becoming more obsolete, and it's expensive. So many times if you've got a subscription, you can do your promotion through the online newspapers. So, and always thank everyone, thank often. You can never say thank you too many times. To your partners, to your staff. Staff love to see their names and be included in your social media and your promotional events and activities that are going on. I've gone ahead and I've given you my contact information there. I may have spoken a little bit quickly because I know I want to hear also what Rebecca has going on. So please feel free to email me or call me, reach out to me if you have any questions or ideas, share them. It's funny, I'm on the National Health Center Week page, and oddly enough, there's only 4 states that have events posted. So I'm challenging everybody that by next week at this time, that we have every state having at least one event posted on the National Health Center Week website. So thank you all, Elizabeth, Amanda, Dorian, great to talk to you, and congratulations everybody on having a great National Health Center Week.
Thanks so much, Molly. And just one quick question for you that came in. Can you clarify by what you mean as by line staff for folks who may not be sure?
Sure. Line staff to us is our front desk people, our medical assistants, our lab techs, our warehouse people, anybody who's not a clinician or works in the administrative role.
Great. Thank you. And now let's go ahead and turn it over to Rebecca Shaw to share what she does for National Health Center Week.
Hello, everyone. Thank you very much for having me, Elizabeth. I appreciate that very much. I just wanted to share some of the things that Molly has talked about and also what Amanda mentioned earlier. Please consider utilizing the tools and the resources that they have readily available to all of us. It truly does help to empower us and to be creative during National Health Center Week. It's also a perfect time to remember for all of us to demonstrate what we take pride in doing every day for our patients. So utilize the examples that were in the previous PowerPoint on the focus days. So for us here at Lorain County Health and Dentistry, the Public Housing Day is a wonderful opportunity for us to plan events during that day on the 15th, since we do have a site located right within public housing. You may also want to think about looking out to, as Molly mentioned, some of your local collaborations. That's a wonderful way to do some type of screenings or to have produce distribution, something that you've done with your partners. Just amp it up a little bit, make it more public, and again, utilize those resources, Facebook, Twitter, social media, radio. You may also want to consider the opportunity of bringing awareness by utilizing some of the resources that are available to us to purchase during National Health Center Week. One of the things that we do every year is we budget for the National Health Center Week banner, and then we have those installed. But the unique thing that we do here is we leave those banners up annually until we replace them with a new one for the next year. And it is amazing the amount of conversation that is generated through patients, vendors, and those that visit our health center. Well, what is National Health Center Week? Why do you have this posted in October? And not only does that generate conversations, but it's amazing that some of the vendors that we utilize for purchases that we make within our community health center that want to reach out to help to support us. So that's just another way of engaging your community. One of the things that we have here in Lorain County is we have a volunteer connection. So look in your community to see, as also Molly mentioned, where else can you get support from? Is it through the Boy Scouts, the Girl Scouts? Is it through organizations that need to do community services? Is it something through other organizations that want to piggyback off of what you're doing to bring awareness of those services as well? So not only can you have the community health center, you could have the local college, you could have your library. So look around your neighborhood, take a walk around the blocks where you're located and see who else you can engage to be a part of this, because the more that you look to see, it's amazing what's within reach for you. The other thing that I want to bring to your attention that we like about National Health Center Week is it really is another way to build your advocates. This is an opportunity to sign up and to challenge those that have not yet become advocates for your community health center to do that. Other than that, I think that you should really look into what you have and where your strengths are within your own organization. I don't know how many people are on this call. If you have a large budget, if you have tremendous amount of staff, if you have a smaller group, look to see where your strengths are and focus on those, and then reach out to those around you to help with that support.
Fantastic. Thanks, Rebecca. And I know you guys do a great job. I will share with everybody, I have had the opportunity to get out to Lorain County, their public housing event last year, and it was really fantastic. So I was really, really happy I was able to do that. A fun time, people were engaged, and the staff, I think, had a fun time too. So thanks to you both for sharing, and we will move right along here. And don't forget, if you have any questions, feel free to put those in the chat box, and we'll answer those towards the end of the webinar. But I'm not going to go through this step by step because I think both Molly and Rebecca spoke to many of these pieces in the 5 steps to success for your Health Center Week event. I think it's a no-brainer. Planning, got to start early. You all on the webinar today are already doing that just by participating. It's May, but August will be here before we know it. The second piece, teamwork, planning support, and benchmarks are incredibly important. Again, as Rebecca said, whether you have a large staff that's able to help out or it's just going to be you or one person at your health center, consider delegating some of the work, creating a committee, and working with local partner organizations so that it's not necessarily just one person or even just the health center doing all of the work for your event and for that whole week. And also make sure you have board and leadership support. I think that's another key piece so that you are able to do that delegation, also, you know, to buy things, as Rebecca mentioned, that you might want to have on hand for your events, and just so that everybody in the community knows that this truly is a team effort and that everyone is behind you. The third piece is outreach. Obviously, you want to send invitations to, you know, your local partners and businesses that you have relationships with, but don't forget about your local, state, and federal elected officials, and I'll get a little bit more into this in the next couple of slides. Sponsorship is another piece, and I will get into that in the next slide. But don't forget the media, as Rebecca said, radio, TV, newspaper, online, some of the things that Molly mentioned. That's just another great way to get the word out to people who may not know anything about the health center. This is one of the best ways to bring them into the fold. It's a fun time. Hopefully, you know, they'll either come in for services after that or at least just spread the word on their own. And then be persistent. Creating a timeline is really key so that you can plan effectively, and then you can sort of do your follow-up if you haven't heard from your elected officials or the media or any of your other invitees. I think elected officials are probably the best example of a place where you're going to need to be persistent, especially members of Congress. Even though it is a recess week, They usually don't like to get back to you right away as they're nailing down their schedules for the end of the summer. So that's definitely a place where you're going to have to be persistent. And make sure that your communications plan includes regular updates for everyone else, for your sponsors, but also for attendees and the public, especially if you have last-minute change of time or change of venue. How are you going to get that information out to folks so that they're aware? And then, as Molly said, thank yous and notes of success are probably one of the most important things you can do. You have to report out to people, but then that'll make them want to keep coming year after year. Your sponsors may invest more year after year with those reports and thank yous, so it's something not to be overlooked for sure. To talk a little bit specifically about the how-tos of sponsorship, there are a lot of different types of sponsorships that you can seek, whether it's in-kind, sort of straight cash, or through participation in volunteers. I think this is a space where you can really be creative and think about what it is that you need for your event, who in the community can give it to you, and how can you make it a mutually beneficial situation for all parties. In terms of securing those sponsors, NAC can certainly help out with that. Every year, as Amanda mentioned, we have a wonderful cadre of sponsors who support us at the national level, but as she said, a lot of that money goes right back into supporting events on the ground in local communities across the country. So let us know. The best way to do that, to let us know, is to post your event on the Health Center Week website, and that way we can go in and see what's going on and work with the sponsors to figure out where in the country they want to be, what types of events they want to support, and even who from their team can be there in person to celebrate with you. And again, as I said, this is a place where you can be creative and think outside the box. Is it a local grocer who can support you with a couple of cases of water if you're having a 5K or a walk? Or is it, a local printing company that can help you with some of your printing and other customizable Health Center Week swag needs, in addition to what's available on the Health Center Week store website? I think one of the most important pieces of National Health Center Week is the Member of Congress aspect. It's always during the second week or so of August, and that timing is not happenstance. That is purposeful because it is August recess. As I said, start early and be persistent. This is a great opportunity to get members of Congress out to your health center to do that education piece, but really also to show your appreciation and support of their support of you. Hopefully they've been supportive in the last year. But nobody wants to miss a great photo op with smiling kids and fun bike giveaways or haircuts, as Molly mentioned. So start early and be persistent, and I would encourage you to work with both staff in DC and also in the district or state offices. I will tell you that NAC every year sends sort of a generic invitation to all members of Congress that usually goes out the first week of June. So we will be doing that again. But we certainly encourage them to be in touch with their state primary care associations. They can always sort of connect to you and to the PCAs through us, but we really do sort of send that out just as a baseline, and then we really hope that you reach out to them individually to get them out to your health center. Flexibility is key. I really think that that's something important to keep in mind. If a member of Congress can't come to the event that you already have scheduled, but they can come the next day, I'd say that's an emphatic yes. I wouldn't say, oh, well, that's not really the date or time that we were hoping for, so no thanks. Get them out whenever you can. Their time is valuable just as yours, so I would say whenever they are available, I would snatch that opportunity. And if they can't attend in person, invite their staff. Let them know that that's all right too. You'd love to have them, and that everyone is welcome. We're not necessarily in an election year, but as Molly highlighted, campaign events and campaigning are strictly prohibited. This is really a time for education, celebration, and appreciation. So be sure that you're paying attention to timing and rules around campaign activities. And then a shameless plug for posting your events. As Amanda said, we do have a brand new and improved National Health Center Week website. And on the front page, you'll see, I think it's a purple map that says post your events. So that's a real easy way to get to that page on our website. but please post your events as soon as you have the details. We are working on a function for you to be able to edit your events once you go in, so don't feel like you have to have every last detail nailed down at this moment. But put up what you have and then feel free to go back and edit it later. And with that, I'm going to turn it over to Dorian Wanzer to talk about the video and picture contest and our social media.
Hope you can hear me. Hi everyone, this is Dorian. I hope you can hear me. This year, again, we're going to be doing the 2017 Picture and Video Contest. It's always exciting, a great time of year, a great time for everybody to get creative. So now's the time to really start thinking about how you want to participate in the contest. Remember, the theme is that health centers are the key to healthy communities. So I would try to incorporate that into some of your pictures and videos, but as always, you know, be creative. That's what we look for. We're going to have a well, I'll get to that in the next slide, but we definitely encourage you to do that. You'll win some awesome prizes, so please be sure to participate if you haven't in the past, and if you have already in the past, we encourage you to do it again. Save the date, as I was just going to say, for July 19th at 3 p.m. we'll be having a picture and video contest webinar, and you can find out kind of the timeline, what's in store in terms of prizes, and just tips and tricks for being a part of the contest and how to have an effective video or picture. So you can RSVP for that at hcadvocacy.org/events. In terms of social media, as I'm sure if you participated in the past, you know that we have our official hashtag, which is NHCW and then the year, so of course this year is 17. And we also want to encourage you to use value CHCs, which was something that was introduced back in March, a little bit before the Policy and Issues Forum. As you take pictures, as you have legislators come to your events, all of those things, we want you to share those on social media and definitely tag us and tag that and use the hashtag so that we can keep track and kind of see all the wonderful posts that occur throughout that week and really throughout August, since it kind of morphs into Health Center Month. On the left side of the screen, you'll see the invite that we've created, which is available on the Health Center Week website. It is something that you can use to invite your legislators to your events. It makes it very easy to go on. You can put in your information. You can invite them. We would obviously encourage you to send the email. It's a little bit more formal, but you can also tweet them and message them on Facebook. I don't know if my slide hasn't moved. Hopefully you can see it now. Okay, here we go. Sorry if you weren't able to see the slide before. So on the left side of the screen, again, I'll start over. You can see the National Health Center Week invite. That is something that we've created, so you can simply invite your legislators to your events. You can send them an email, and there's text already there for you. If you'd like to customize it a bit, you can. And then you can also send them a message on Twitter or on Facebook. So that's available on healthcenterweek.org. And then to the right, you'll just see, hopefully it's not too small, just an example of how you can incorporate some of the hashtags NHCW17 and value CHCs. If you look further on our website at social media tools, you'll be able to get access to graphics and things like that you can share. If any of you have visited our Facebook page today, HC Advocacy, you'll see that we've updated the cover photo, and it's for National Health Center Week. So that's available to you as well. You can download it from our website, and it's also available in Spanish. In terms of other tools and resources on the website this year, we have activities and event ideas. Some great things if you're kind of starting out fresh for the first time, or you want to switch things up, you can visit that part of our site and get some great ideas. A media toolkit is forthcoming. It should be on the website in the next month or so, but we will have op-ed materials or templates and letter to the editor templates, things like that, so you can make sure that your events and your health center are out in the traditional media. As I just said, there are social media tools on there. You have access to sample posts or sample tweets that you can use for Facebook and Twitter. You can get some of the graphics to use for your cover photos on Twitter and Facebook, or just in general for posts. And then there are some specific images and tweets that can be shared for one of our focus days. So make sure to take a look at that. We will be having a proclamation template that will be available coming soon. We encourage you guys each year to get those proclamations in your cities, towns, states to make sure that Health Center Week is recognized. There are some updated fact sheets which are available. Definitely want to check out those. We've got some new data that's specific to health centers, and you want to make sure that that's all up to date too. Some of our numbers have changed. There are some great resources in terms of sponsorship and how to get sponsorship and how to engage sponsors. Just as Amanda said earlier, this presentation will be recorded and it will be available on our website as our other past webinars and presentations, so those are there for you. And then all of the materials in terms of social media and the media toolkit are available in Spanish, so you'll have access to that. And then last but not least, of course, we have the National Health Center Week store, where you can get all the goods and the swag that you need to have a great event and to keep people coming back. So there are tons of tools and resources. The list could go on and on, but make sure to visit healthcenterweek.org to access those materials. I guess I should pass it over to Amanda here, because I think she's going to close it out and make one last plug for events. So 1 second.
Yeah, thanks, Dorian. And we are going to make one last plug. So related to a number of different spaces, the first and foremost is that for those of you who are interested in being paired up with one of our national sponsors, you heard me say earlier that their support nationally actually goes right back out into the field in the form of local event sponsorships. Well, the first place that I go to look and see how best to pair our national sponsors is on our Health Center Week website, where you guys post your events. And so it is very, very important, if you want to have access to those opportunities. As much as I wish I could say we're going to give them to every single health center out there who's going to host an event, we're not quite to that point yet, though it is a personal goal of mine to get there. But for the time being, the very best way for you to get plugged into those opportunities is by posting your event on the website. So again, it's a very simple, straightforward process. For those of you that have been at this for years, you'll see it is very familiar and has not changed much since the past go-rounds with this. And for folks that are doing it for the first time, we've tried to make this really simple and straightforward to collect the information and also to allow you to edit your event over time. There are still a few issues and kinks being worked out of the new website, but we expect those two to be sort of completely fleshed out over the next couple of weeks. And I would echo Molly's charge that everybody get their event plans posted maybe by the end of the week, but as soon as they can. There's no time to waste. And so even if it's sort of partial information at this stage, still really wonderful to have that stuff in there. The other thing that I would say, and I think, let me see if I can get to, oops, we're skipping around here. In terms of upcoming events, we do have some things that we want to make sure everybody has on the radar. Our Policy and Advocacy Update webinar is going to be next week, May 17th at 3:30 p.m. This is something that we do monthly. The point of these is to get everybody up to speed on what's happening in Washington and around the country in terms of health center policy priorities. Obviously, there was a lot of action in Congress last week in the House with the AHCA, and now we move on to the Senate, and so there's an awful lot of work going on there in terms of supporting the health center policy agenda, but also on the advocacy front. So please tune into that webinar. It is something, again, that we do monthly because things are changing so quickly, and we're counting on you guys in the field to help us deliver the health center message. And Health Center Week will be a big part of that year, It will be a big part of that this year. The other is that we will be hosting our National Health Center Week Photo and Video Contest webinar on Wednesday, July 19th at 3 p.m. That is the best way to get up to speed on all of the do's and don'ts, the specifics around the contest. I should also mention we are very grateful for our contest sponsors, Pfizer RX Pathways for our photo contest and Athena Health for our video contest. Again, their sponsorship allows us to really provide great resources back out into the field to build up those contests. But one of the most exciting elements of the contest, frankly, is that all of the submissions are from health centers in the field, and then throughout the course of the month in August, which is the submission period, is the duration of August, we narrow in on finalists, and then it is actually the Health Center Advocacy Network, it is you all who determine the winners of those contests. So it is truly a health center-driven event for both the photo and the video contest, and we just look forward so much every year to seeing the submissions that come in and the wonderful events that are going on and the ways that we can showcase and celebrate your work. So tune in for that webinar. We'll have some more great speakers there and, again, sort of showcase all the resources to support you in that effort. So I think we did have a few questions come in. I know one in particular came from a staff member at a primary care association who works on communications who asked, if you are at a PCA, sort of what are the things specifically that you can be doing to support your health centers? And it's a good question, and it has come up in the past. So the ways in which primary care associations engage during Health Center Week tends to be a little bit different than health centers. But I would say some of the key elements that you could do, the PCAs are often the driver in securing, for example, a proclamation with your governor, recognizing National Health Center Week, the same way that we work hard every year to secure a presidential proclamation recognizing National Health Center Week. So that's one thing that the PCA can take a lead role in. I think supporting health centers as they're looking to engage their state and local elected officials, whether that is helping them with talking points for state-specific issues, helping them to arrange events and or, with the scheduling of things, helping them to do their homework, around who they're talking with and understanding what's important to that particular official. So I think there's a lot of work that the PCA and in particular communication staff can do on that front. There are a number of PCAs who actually work very hard and are very successful at doing statewide sponsorship to support events, and then the PCA works very similarly to NAC, where those sponsorship dollars are then sort of distributed out to health centers around the state. So it's sort of a model of a model, and if you're interested, I'm happy to put you in touch with some of the PCAs that are doing that really well. The other thing is that a number of PCAs actually sponsor statewide events where all of the health centers in the state sort of convene on one particular day for an event hosted by the Primary Care Association. Sometimes it is in the state capitol, sometimes it is at one of the health centers strategically located around the state. It's sort of your call to make, but I think as a Primary Care Association staff, and particularly in the space of communications, it's worth considering how you might organize an event like that. It's a great way to bring all of your health centers together and sort of join together in putting on, a bigger, better, greater celebration that's statewide. And then the last piece that I would hone in on the Primary Care Association side has to do with state-based data. And so I think the Primary Care Association can be very, very helpful and successful in producing data and state-specific information that the health centers can then use to place and share with everyone from elected officials, state and local elected officials, to media, to influencers in the community, to creating brag sheets. I mean, there's any number of uses for that state-specific, county-specific, community-specific data, and so I think the PCA can really be valuable in that space as well. So those are some right off the top of my head. I would wager that there are many Primary Care Association staff on the call and who are always willing to help and share, as are our health center colleagues. So if you have further questions about that, just make sure to email us after the webinar today, and we'd be happy to connect with you. But Elizabeth, were there other questions that came in or anything else we need to cover?
Yes, I have a couple questions here. The first one is, should you choose one location or have celebrations at multiple locations?
That's a really good question. I think that's a determination for each health center to decide. I don't think there's any harm in hosting events at multiple locations. particularly if your goal is to engage your community and help them understand what's important and wonderful and successful about the services you're providing in that particular space. But I think it really depends on bandwidth. I think it can be a win either way. And so for folks that are sort of, oh, I'm not sure, maybe test one model this year and another model next year. But I think, from our eyes and the eyes of NAC, you are no more or less successful if you choose to host a series of events at one location versus a series of events across multiple locations. So we leave that one up to you guys as the best judge of how that should operate.
Great, thanks. And I think this next one is something you can weigh in on, but I also would be interested to hear from Molly and Rebecca if they had thoughts. Do you have any suggestions on how to encourage patient participation?
Yeah, you know what, it is a really great point and question. I think anytime we can engage our patient population, we're doing good, especially in the advocacy space. And I would say often what we find is that simply posing the question and doing that baseline education about the fact, for example, that health centers are part of, your health center is a part of the largest network of primary care providers in the country. And that, the care that they're receiving at their health center stands up to, private providers and as the highest quality. So I think, again, part of what we're trying to do with National Health Center Week is educate and help people understand what makes health centers different, unique, and so valuable to the community in so many different ways. And so I think as I see it, engaging the patient base, that's a great starting point. And then I think as you're having that conversation, it's then a really wonderful opportunity, as I think both Molly and Rebecca kind of pointed to then ask them if they'd like to be an advocate, if they'd be willing to stand up and support the health center by signing up and or attending events or sort of speaking to the value that they've received in receiving care at the health center and these types of things. So those are some of the basics, but I agree. I think it would be wonderful to hear from Molly and Rebecca about any other sort of areas where they think they can be successful.
Is our microphone on?
Yep, we can hear you.
Yes.
Okay, I'm sorry. This is Molly. One of the things that we do is we start with the people closest to us. We start with our board members. For federally qualified health centers, 51% are required to be, patients or users of your services. So start with them. They're great representation of your center and your communities.
I would agree. That's something else that we do as well. Another point that I wanted to bring up, and I don't know if this is directly to that question, but during National Health Center Week, we have a wonderful president and CEO that loves to have our staff also participate. Many of them throughout the day are with the patients. So we have Spirit Week here at Lorain County Health and Dentistry. And it's a wonderful way to have a conversation with the patients. One of the patients may ask their adult provider, why are you dressed up as a cowboy? And he'll say, it's National Health Center Week, and today is Western Wednesday. And so it's just another way, as you were saying earlier, to engage, to bring that awareness. And then we also post at each site that it is National Health Center Week. So if the staff are dressed differently or appear out of their typical attire, it's due to National Health Center Week. And we found by the end of the week, we actually had some patients that were scheduled for different services that had come in and they were participating as well. And that was really something to see, that someone came in on one day for a service and they came back another day for another service, or another reason that they were here and they knew that on that particular day that it was part of National Health Center Week and Spirit Week. So they dressed up as well. So it was really engaging not only the staff, but the patients as well.
Great, thank you. Question for you, Amanda. Does the event have to be during the actual week of Health Center Week?
Oh, I'm so glad that someone asked, because it is my favorite thing to answer. You know what? We have been so fortunate, and it's really due to the hard work of you all on the webinar and so many others around the country, that Health Center Week is as small as it will ever be. It gets bigger and bigger and more exciting and celebratory every year. And as such, it really has become Health Center Month. We have to designate a week within the month of August because, frankly, from a recognition standpoint and from a focus standpoint, it is important to do that. But in the view of NAC, any event that falls in the month of August really can be deemed a National Health Center Week event. And I would even give you a tiny bit of wiggle room for the first couple days of September and the last couple days of July. And my point is, if you have an important anniversary or you've got a ribbon cutting or you're trying to get your member of Congress out to your health center, and the only time that you can get it done is just before or just after National Health Center Week or sometime in the month of August, but not those technical dates, that is absolutely okay. We totally understand and encourage, and really we're just looking for engagement. We want to do everything we can to sing from the rooftops every day of August about the important role that health centers play across the country and really to the healthcare system as a whole. So by all means, it does not have to fall during the 13th to the 19th. It is wonderful when it does because it really ramps up and turns up the volume for the national celebration, because that is where the biggest emphasis happens to fall. But again, if you happen to fall outside that time frame for one reason or the other, we get it, and that's fine. It is still a National Health Center Week event, and we will celebrate right along with you.
Great. I think we have time for maybe one or two more questions, so here's another one. Are there any suggestions you can provide for a health center with a very diverse patient population who primarily do not speak English?
Yeah, I think that's a great question. And actually, so we have a member of our team, Alex Harris, who's our grassroots advocacy manager for special populations, who would ordinarily be the perfect person to answer this one, but I'll stand in for Alex, which is hard to do. And so the short answer is we do have translated materials. Now, our translated materials are often in Spanish. We're always looking for additional staff and resources to translate into the literally several hundreds of languages that we know patients are speaking in health centers. But what I would say is allow yourself the time to be able to do some of that translation work. I suspect if you're working with a diverse set of languages in your community or a diverse population in your community, then you probably have some means to do some of that translation work and really to craft an event format that's going to resonate with that population. So I think part of the purpose for starting early is to enable you and empower you to craft an event that's going to work for you. In terms of the specific translations, like I said, we're on top of it when it comes to Spanish. We've had some great luck partnering with the folks at APJO who work with the Asian Pacific Islander populations. And then we also have a number of health centers who frankly are working with a very diverse set of patients and languages, and so they over time have had to become skilled in translation for their own purposes in the community, and so we do call upon them at times to help us when necessary. So that's the starting point. If you've got specific questions beyond that, please be in touch with us. We're always looking for ways that we can improve and be most helpful, and so we'd like to work with you going forward.
Great. And I want to be respectful of people's time. There were a couple of other questions, so I will be sure to follow up with you after the webinar to get those answered, so thank you very much. But just a couple of reminders, this webinar was recorded and will be posted to both of our websites in the next couple of days. Go to the Health Center Week website and click on that purple map to post your event. And Amanda, any other closing comments?
You know, I don't think so. Just we're so excited that y'all were able to join us today. This really is our favorite time of the year. I have high expectations for another wonderful year of events and success. We also really love to hear about new event ideas, new event formats, and just creativity that seems to flow wildly during National Health Center Week. So don't be shy about sharing your plans with us, posting them on the website, but also emailing to let us know. And the other thing, Remember that part of the intention with National Health Center Week, and frankly with everything going on in Washington, D.C., part of the intention is to be setting up time to connect with your elected officials and in particular your members of Congress. So be sure to reach out to them early and often, and if you are able to secure confirmation that they will attend one of your events, please let us know as soon as possible so we can connect you with supporting resources for that specific purpose as well. And otherwise, we're excited to work with you guys. Enjoy the planning, and we'll look forward to hearing from you in the days ahead. So happy Health Center Week, everybody.